We're going to talk about neck issues, head and neck. It's extremely common to see after brain injuries and strokes and spinal cord injuries a torticollis of the neck. And this can be forward, can be hyperextension with upper extremity extensor tone, but we really see a lot of side to side. It's amazing. That can be with the wry neck, with the twisting, or it can simply be lateral. We want to catch those as soon as we can, but it's amazing how many times we actually take an ear off the shoulder. It's that severe. And if you think about it, how can these people breathe? How can they swallow? Are they prone to pneumonia because they're not getting good lung expansion? That's a huge problem with all types of contractures, but especially with your spinal patients and when head and neck are involved. But right now we're going to talk about just forward flexion. It can be with tone or without tone. It might simply be that a lack of muscle tone is making the patient go forward, and once they start forward, the weight of the upper body and head continues them forward again. Gravity is not our friend. You see a lot of patients from infants on up who have this problem. They have it could be hypotonic necks with cerebral palsy kids. That's very common. And as they develop tone, then you want to reduce that tone and spasticity. So this type of device, this is a cervical extension, and it's flexible. So it does that fishing pole flex technology, but it will bring the head up gradually. It's very heat moldable. To see how to heat mold, just refer to our videos on heat molding that are on restorativemedical.com or on marmedical.com on the websites. Once you have your patient in the TLSO and you set them up, there's a pocket in the back, and they all come with this. So your patient may not need a head neck attachment at first, but they may need it later, or you may think they don't. And when you fit them, they actually do. But sometimes by the time you get your TLSO on and bring their posture up, their head will come up too. But we put the pocket on all of these just in case, so you don't have to order a new device if they do need a neck straightening. This just simply slides down in the back, and you can adjust the height. These are shipped with the right height according to the size you chose of your TLSO. Again, you have that flexibility. The forehead strap goes around their forehead. You're going to heat mold the back so it fits them very nicely. And by bringing them up, they're able to view their environment and remain oriented. If your head is in your lap or even down all day, you're not going to get enough oxygen to your brain, and you will become oriented. It's just a matter of it's a matter of how long it takes you. So we want to make sure that we hold their head up for eating. These kids and these adults, if they have these neck issues, someone has to hold their forehead up and put food in their mouth. With this, they're comfortably up, there's nothing under their chin to restrict them, and they can eat and chew, and their jaw can work. So we want them to be brought up. Now, this can actually be like an exercise that they'll regain good, healthy muscle tone. Anytime you pull against resistance and it brings you back, you're working those muscles, you're exercising them as if you're at the gym lifting weights. So it's possible that you will regain enough muscle control that this cervical portion can be discontinued. But don't throw it away. don't do away with it. At some point in time, they may need it again for a maintenance. You may have to go down to from wearing it every day to once a week, maybe once a month, or just as needed. So it's a very, very good product for people from infants all the way up, and this is called your cervical extension for forward flexion of the neck and head.